Itchy mouth, swollen tongue, rashes and wheezing. Often the first symptoms to appear if you are allergic to a specific food. While for a long time, food allergies were considered to affect only the Western population, many cases of food allergies have emerged in the country in recent years. Without proper understanding, management of food allergies are difficult and can be, in rare cases, fatal too. Hence, in our next segment, we will focus on food allergies, their causes and management.
It is a pleasant monsoon evening, and you decide to take out your family and friends for a sumptuous dinner. There is a variety of food served on the table, but no longer than few minutes after the dinner starts, that one of the kids starts breaking out into rashes and experience wheezing. Once rushed to the hospital, the child is most likely to be diagnosed with food allergy. While 25% of Indian population is known to suffer from this condition called food allergy, with children at particularly high risk, the severity of the problem is as high as 40% in the West. While most of the food allergies are not life-threatening, beware. Cases have been reported where certain allergic reactions to food can be fatal. Physicians define food allergy as an abnormal immune response to food. The immune system is responsible for identifying external pathogens and terminating them before they cause infection. Sometimes, certain proteins in the food we consume are recognized as harmful pathogens by the body's immune mechanism. Under such conditions, the immune cells start producing a special type of antibody called immunoglobulin E or IgE to identify the allergenic proteins and initiate the allergic reaction.
Among 1.5 lakhs, there are 5,000 proteins which are allergenic in nature. Now, these proteins may be present in the environment in the form of the pollens, fungi, dust mite or certain insect excreta, or it may be present in the food also, or it may be present in some contactant also. So, food is there which is one of the commonest which is responsible for allergenic in nature, because there are many foods which has got a IgE binding sites. If a food is having a more IgE binding sites, that is called epitopes, that is more allergenic.
In response to this, tissues in different parts of the body release chemicals like histamine that causes the airways to tighten and leads to other symptoms. This type of reaction is quick and develops within minutes of exposure to allergic food. In certain cases, the immune response may not involve immunoglobulin E and may occur some hours after eating. Now, the natural question that must be arising in your mind is how to identify a food allergy. There is a checklist of symptoms to watch out for, especially if they develop quickly after eating. These symptoms include itching of mouth or swollen tongue, itchy skin rashes or eczema commonly known as hives, tight hoarse throat and trouble in breathing and swallowing, wheezing and repetitive cough, runny nose, swelling of face around eyes and lips, pale or blue coloring of skin, dizziness and nausea, vomiting, diarrhea or abdominal cramps and pain, drop in blood pressure. The most serious and often deadly symptom to watch out for is anaphylaxis, the condition that affects the whole body within minutes, impairs breathing and sends the body into shock. Most food-related symptoms occur within 2 hours of ingestion and often they start within minutes. Delayed reactions by 4 to 6 hours are rare and most typically seen in children. And now, if you thought that such allergies are genetic, these allergies can develop at any age and stage of life. Food allergies are generally diagnosed using skin prick tests, patch tests and blood tests, and treated using medications like steroids, epinephrine and antihistamines. The best and safest way to prevent food allergy is to avoid the allergy-causing food or allergens. In children, this might commonly include milk, eggs and peanuts, while adults are more prone to raw fruits and vegetables, soy, wheat, peanuts and tree nuts like almonds and walnuts, seafood such as shellfish, lobster, etc. In India, allergy has been reported for brinjal, cucumber, lady's finger and papaya, along with food additives such as Ajinomoto and seeds like mustard and sesame. Forget about eating. Cases are reported where even indirect contact with peanut shells or other allergens can result in extreme reactions. Hence, while it is important for allergic individuals to maintain strict diet, most important under such situations is to seek immediate medical help. Self-medication can lead to more complications. According to statistics, food allergies cause roughly 30,000 emergency treatments and 100 to 200 deaths per year in the nation. So, the next time you play the role of a gracious host, it might do well to gather information about the allergies which your guests may be prone to. This knowledge may save a life.